Hello, my name is Dr. Patrick Ford, and I am Director of Thoracic Oncology Clinical Research Program at Johns Hopkins University. Today I'm going to talk about the initial evaluation and frontline systemic therapy options for malignant pleural mesothelioma. Mesothelioma is a rare disease. Just under 3,000 people are diagnosed with mesothelioma each year in the United States. The large majority of cases are associated with asbestos exposure. And this is an unusual disease in that the onset of mesothelioma is anything from a median of 30 to 40 years after exposure to the carcinogen. Initial evaluation of a patient with mesothelioma involves a radiographic staging, CT of chest and upper abdomen with contrast. You'll see on this slide the area of mesothelioma in the right lung encasing the lung. PET CT scan can be useful to clarify the extent of disease and help determine if the tumor is resectable. Prior to surgery, it's also recommended to stage the mediastinum using either bronchoscopy and EBUS or mediastinoscopy. The staging of mesothelioma follows the traditional TNM system, and this is prognostic with a median survival for stage 1 disease of approximately 20 months, ranging down to 11 months for stage 4 disease. In general, stages 1 or 2 involve the ipsilateral pleura and may be amenable to surgical resection. Stage 3 disease involves the lymph nodes, and most cases are not considered surgically operable. Stage 4 disease is unresectable, may involve the contralateral hemithorax, or have distant metastasis. Probably the most important distinction within mesothelioma prognosis is between histologic types. The most common type in 75 to 80% of cases is epithelial. Sarcomatoid is a more aggressive subtype, taking up 10 to 15% of cases, and the remainder are biphasic, which is in general a mixture of the two, epithelial and sarcomatoid. Prognosis for epithelial is approximately 19 months historically. It's much poorer with sarcomatoid disease, measuring only 8 months as a median. In trying to determine whether a patient is a surgical candidate, and this generally applies to approximately 20% of patients, the basic requirements are that disease is limited to one hemithorax, so stage 1 to 3. There is no involvement of the lung parenchyma. The patient is physically fit and does not have any medical contraindications given the potential extent of the surgery. And in general, there should be little or no lymph node involvement. Certain features convey a poor prognosis with surgery. These include histologic types other than epithelioid, male sex, and chest wall pain at the time of presentation. Let's compare the surgical approaches used. Extrapleural pneumonectomy was historically the operation of choice. However, in some older series, led to very high operative mortality. More recent series show a mortality of approximately 5%, which is still significant. Median survival has been reported from 9.5 to 27.5 months, depending on the study. And there is significant perioperative morbidity, so patient selection is very important. More recently, extended pleurectomy and decortication has probably become the more common approach in the United States and worldwide for surgery for mesothelioma. This has the potential to preserve the lung and lung function. Median survival reports in general from retrospective series have been similar to that seen with EPP, and operative mortality is lower, ranging from 0 to 9.8%. Local recurrence is, however, higher, and in general, postoperative radiation is recommended if extended pleurectomy and decortication is performed, and it's also safer for extrapleural pneumonectomy. However, with pleurectomy and decortication, there is concern for pneumonitis. Cisplatin Pemetrexed has been the standard systemic therapy for mesothelioma now for over 15 years. This was based on a study by Dr. Vogelsang and colleagues published in 2004, which showed a median survival of 12.1 months for patients who received the platinum doublet and 9.3 months for cisplatin alone. So in conclusion, mesothelioma is a rare cancer with a poor prognosis. Multimodality therapy is important for selected patients. And between 2004 and 2020, the only approved systemic therapy was Cisplatin Pemetrexed. Thank you.